Welcome, everyone. Thank you for joining us today. I'm Theresa, Marentette, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Overall, 13,271 individuals have been tested for COVID-19. Currently, we have 1,592 tests that are pending. For those of you who are awaiting test results for COVID-19, please check the Ministry of Health's online portal or the link on our website. Please remember that while you are awaiting your results, you must remain in self-isolation. I will now share the most current case counts. There are 73,401 confirmed cases of COVID-19 in Canada and 21,494 cases in Ontario. Chatham-Kent has 108 cases, and Sarnia-Lambton has reported 213 cases. Michigan now has 49,582 cases, with 10,164 cases being in Detroit. Today, we are reporting 762 cases of COVID-19 in our community, an increase of 11 cases from yesterday. 38% of our cases have occurred in long-term care homes among residents and staff. 396 cases are now resolved. 20 people are in hospital. 17% of our cases are between the ages of 20 and 29 years. 15% of our cases are between the ages of 50 and 59 years, and 20% of our cases are 80 years or older. 42% are male, and 57% are female, with 1% unknown. Our community has lost a total of 62 people to COVID-19. 47 deaths have occurred among residents in long-term care and retirement homes. Our health unit is working with 18 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. Testing for COVID-19 is based on a clinical assessment. Common symptoms include fever, a new or worsening cough, and shortness of breath. However, other symptoms may be present, such as a sore throat, unexplained fatigue, an increase in falls, nausea, vomiting, chills, and headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, there are several options. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit ehealthwindsor-essex.ca. Windsor-Essex has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital at the Olet campus. Please note that testing is available for people who have symptoms of COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. As we go into the long weekend, please be reminded that we will resume our Facebook Live sessions on Tuesday, May 19th. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone, and thank you for joining us again. As the weather continues to get better, with more businesses opening up, it is now even more important for all of us to follow public health recommendations to protect yourself and also your loved ones. As you read information available on various platforms, especially on social media, please be careful. Not everything you read is accurate or factual. I would urge you to please look for credible information and do not fall into the trap of misinformation. Our website, www.wechu.org, contains a lot of good, credible information for everyone, whether you're a professional or a community member. You can also visit other credible information sites such as Public Health Ontario, Government of Canada, CDC, World Health Organization, or other credible agencies. Please trust the experts. With the help of all of you who have come, we have come this far. We, that is all of us in the community, prevented the surge in the hospital. We helped to reduce the transmission in the community. At this point, I would like to acknowledge the work of my team everyone, including the leadership team, the management team, communication team, planning team, our nurses, our public health inspectors, our clerks, our dental team, our epidemiologists, our health promotion specialists, our tobacco enforcement officers, our social workers, our IT team, our facilities team, everyone. Thank you. For all the work that you are doing, each one of you have worked tirelessly, often 2 to 3 times more than your normal work volume, and all of you played the most important role in bringing us to this point where we are in reducing the transmission of COVID-19 in our community. Thank you. This is what we will cover in our presentation today, and I'll focus on the key points to answer some of the questions that everyone asked, including myself, and then we'll draw some conclusion based on the data to help us apply evidence-based decision-making in public health recommendations. Okay, so sorry about the delay. So now we'll just move on to the slide where I show some of the symptoms-based syndromic surveillance system, which shows the number of admissions in the hospital system. We can see 2 distinct peaks, late March and early April, which was very different than the last year, probably due to increased number of people showing up at the emergency department with symptoms such as influenza-like illness, pneumonia, sepsis, or suspect COVID. Please note that these are not an official diagnosis. These are just based on the syndrome and the number of people who are presenting. So this epidemic curve helps us assess the progression of the disease, whether in the community or in an outbreak situation. This particular epi curve is created to show the confirmed number of cases by their symptom onset date. On your vertical axis, you have the number of confirmed cases, and the horizontal axis, you have the symptom onset date. The significance of using symptom onset date instead of the case reported date is to get a sense of when the disease transmission or exposure happened. Please note that this includes all the cases that are in the community as well as in the long-term care homes. Please also note that the data reported on the shaded area may not be reported yet to public health and may not be entirely accurate and are subject to change. Day-to-day variation can vary significantly, and we know COVID-19 do not cause disease after exposure immediately. It may take up to 14 days to show the symptoms. In order to minimize the impact of day-to-day variation, another way to look at the epi curve is, so welcome back, everyone. We apologize for the technical difficulty. We had a good run for almost 2 months now, except for one glitch today, so we apologize for that. So getting back to our presentation, we were talking about the epidemic curve and showing it by the symptom onset date. So the epidemic curve help us in terms of the progression of the disease to see whether we are having a continued number of cases and if those numbers are declining. In the last slide that I presented, it was day-to-day average, so what day-to-day number of cases. What this slide is meant to show is a 3-day moving average. The 3-day moving average captured day-to-day variation and try to present a much better picture of when the transmission or infection is starting. We can see that roughly to the 2nd or 3rd weeks of April, the symptom onset date is going down and is moving in the right direction. In other words, it is very likely that we passed our peak with respect to symptom onset. Thank you to everyone in our community in playing their part to stay indoors and following public health measures. Please note that the data presented in the shaded area may not be reported yet to public health and may not be entirely correct and subject to change. Next slide. We know we have a lot of our cases in the long-term care home and retirement home. This particular epi curve is created to show the symptom onset date in the community as well as in the long-term care home. Earlier in April, we saw a shift of positive cases from community to long-term care home and retirement home. That was the same time that a number of measures were implemented at the long-term care home and retirement home to ensure the safety of the residents, such as universal masking policy, restricting healthcare worker to work only in one facility, extra support from acute care hospital partners, mass testing, etc. Now that all these measures are in place, we are seeing a decline in the long-term care home and retirement home cases. Next slide. So another way to show the epi curve is by the line by this line graph where you can see that the community cases and the cases in the long-term care home and retirement home, and they're all stabilizing at this point. Next slide. The next logical question comes to our mind is, are we seeing something really bad? Should we be worried? How are the other regions are doing? We looked at the regional and provincial rates per 100,000 population. We used this as statistics to compare the number of cases based on the population size. Please note that this comparison does not account for variation in number of people in different age groups. For example, roughly 18% of our community members are seniors, that is aged 65 plus and older. This is in comparison with the province where we have 16% of the seniors population. Seniors in Sarnia and Lambton make up also roughly around 21 to 22% of their population. And the rest of the province, we can see that those are the numbers of rate per 100,000 population. We are above the provincial average and compared to many of the other regions as well. So next slide, please. The next question that comes to my mind is, how about the testing? How many people are being tested every day? And among those who are tested, how many of them are coming back positive? This is an indicator to show how prevalent the disease is in our community. If more people are getting tested and not a lot of them are coming back positive, that means we have a lot of people are getting tested and a lot of them are coming back positive. That means we have a problem. But if you look at the number of cases that are coming back positive, it's dropping all the way from 20% to roughly 5% or lower. The easiest way to explain that is we're testing more people who do not have the disease. With some of our recent measures, we have ramped up testing in the long-term care homes proactively and decreasing our thresholds for testing early diagnosis and isolating residents in our community. As you can see, the percent positivity is going down significantly, and this is because we are testing a lot of people at this time, and majority of these people are asymptomatic and probably don't have the disease. Next slide. Another question that is frequently asked is about asymptomatic people coming back positive for COVID-19. We did some proactive testing in 38 long-term care and retirement home in our region and tested more than 4,000 residents and more than 2,000 staff in these facilities. This is a preliminary analysis of percent positivity among asymptomatic and symptomatic individuals in these facilities. As you can see, there's a significant variation between symptomatic staff and symptomatic residents, and asymptomatic staff and asymptomatic residents. Based on our analysis, we can say that roughly 0.9% of the residents within a long-term care home or retirement home without any symptoms can still be positive for COVID-19. The number is very low compared to what we would see in cases of more asymptomatic people coming back positive. Roughly 0.4% of all staff that are part of the mass testing were positive and asymptomatic at the same time. However, 2.1% of staff were symptomatic and positive compared to the 1.7% of the resident. Next slide. Then we use our data to give a distribution of age and gender, and the purpose of creating this graph is to show if there's a gender difference in getting infected. Based on the analysis, it appears that among male, COVID cases are highest in the 20 to 29 age group, and it decreases as the age increases. Among female, the distribution is pretty much even between the ages of 20 to 59 years age. Next slide. This graph shows the distribution of COVID-19 cases by municipality. No surprises there. Almost 2/3 of the cases are in Windsor, and more than half of the population, and we know than half of the population live in the city of Windsor, and each of the municipalities are also shown here in this graph. There's a slight increase in Leamington cases compared to previous week, and this is because we have seen an increase in cases among migrant farm workers. Significant differences in number of cases in some of the municipalities are due to the number of positive cases in the long-term care home and retirement home. Same caution, everyone should take precautions irrespective of where they live and keep themselves safe and protected. No one community is better or worse than the others. Next slide, please. Early part of the pandemic in Windsor-Essex, we saw more cases attributed to travel. More recently, we are seeing more transmission happening between close contact, and in the middle, we saw more community transmission. We are seeing a decrease in community transmission now. Please note that the travel in the recent cases are still attributed to the healthcare worker that are currently working in Michigan. This also shows the impact of our measures. If we can track down most of the cases to a close contact, that means we are reducing the community spread. If you look at the cases in the last few weeks, most of the new cases are happening in close contacts. Next slide. Looking further into COVID-19 by healthcare worker status, almost 28% of our cases in our community are healthcare worker, and out of these, roughly 55 of these healthcare workers are working in Michigan. Around 6% of the cases visited a healthcare facility before getting infected. Next slide. Looking further on the risk factors, the most dominant risk factor is cardiovascular disease, following by diabetes, asthma, and obesity. Next slide. Another way to look at the cases whether someone had a chronic underlying health conditions or not, and almost 2/3 of the cases did not have any underlying health conditions, and about 1/3 had some kind of underlying chronic medical condition. Next slide. A quick look at the cases and what symptoms they are presenting. Still 85% of the cases are presenting with cough. This could be a new or worsening cough. Please note that the cases can report more than one symptom, and that is why these numbers may not add up. The next slide. This figure shows the number of hospitalization and patients in the ICU on a given day. It can all include both new patient as well as the existing patients with COVID-19. Cases in the ICU remains relatively low for the past couple of weeks at approximately 3 or so cases. Hospitalizations have stabilized with a slight increase observed this week. New to this week graph is the inclusion of the cases at the field hospital. These primarily include residents from a long-term care home. Next slide. So where we are with all these cases, a little more than half of the cases are resolved or recovered, which is an increase from the last week. A little more than quarter of the cases are self-isolating. This is lower compared to last week. Unfortunately, we lost almost 8% of our cases to COVID-19, similar to last week. Less than 4% of the cases are currently in the hospital or ICU. Some of the cases that are self-isolating may have been admitted to the hospital initially, but discharged when they didn't need inpatient care. Please note this does not include individuals who are at the field hospital. Next slide. Looking at the age and sex breakdown of COVID-19 deaths in our community. Overall, more female died with COVID-19 diagnosis compared to male. From an age distribution perspective, almost 3/4 of the death was in individuals who were 80 years and older. The youngest person that died in our region was a man in his 40s. Next slide. This particular graph shows that what it means for an individual who contracts COVID-19. In our community, the overall case fatality rate is 8.3%. Those who are living in the long-term care home and retirement home, case fatality is significantly high, close to 16%. And that is why all the attention and effort was put in for the long-term care home to protect those individuals, residents living in those long-term care home and retirement home. As of April 29th, the case fatality rate in all of Ontario was 8.4%, which is similar to that of Windsor-Essex. In the long-term care home and retirement home across Ontario, the case fatality rate is almost double that of Windsor-Essex. So now, where are we heading? The doubling time tells us how many days it will take to see twice as many COVID-19 cases in our region. It tells us how quickly COVID-19 is spreading in our area. This specific graph looks at our doubling rate since our first case was reported, and it's a cumulative comparison. Currently, we are seeing past 5 days, considering a case doubling rate of 5 days or more. In late March and in early April, we were doubling every 2 days. Next slide. Our doubling time when looking at a day-to-day over change is relatively better compared to the province and all of Canada from the middle of April, minus a few blips here and there. These blips can be accounted for the early mass testing that was completed by the health unit in collaboration with our EMS partner and our hospital partners in all the long-term care home and retirement home. On an average, we have seen a 2% increase in cases over the past 7 days. This has been consistent in the week prior to this as well. Next slide. R0 give us an estimation of how many one positive case of COVID-19 will create in a community. So this particular graph shows the most recent estimated R0, which is close to 0.86%. To help understand it better, when the R0 is less than 1, that means each existing infection are causing less than 1 new infection. If this trend continues, the disease will continue to decline. The shaded area in the graph in front of you demonstrates that the variation that we may see, just identifying some of the potential errors in the graph. Before we interpret it, there are some assumptions that we need to consider, which is the first case has to be imported, the rest cases are identified as locally acquired cases, and the most accurate date that is used in symptom onset date, which may account for the variation we see. But in overall, any R0 less than 1 is a good sign for the community. That means that the cases are declining in the community. Last slide. In summary, what we can see is case count in Windsor and Essex continues to decline, even with increased testing. 2% of tests were positive for COVID-19 in the past 7 days. Case fatality rates are higher in long-term care home and retirement home compared to the community. Doubling time of cases is generally similar to the province and the country. R0 of less than 1, it's signaling a decline in the community spread. Thank you.
We'll now take questions from the media. We'll start with CTV.
Yeah, doctor, I noticed that the positive cases have been in the low digits or, low teens or, single digits teens. Are you allowed to tell us where those positive cases are coming now? Are they in clusters or is it still pretty spread out that way, or where are we with that?
So most of these cases, we don't, obviously, if the number is too small to give you a breakdown of where these cases are coming from. But what we can tell you is the distribution between a community case versus a contact of a confirmed case. When we are seeing more cases in the contacts of a confirmed case, that means the effort is good and we should continue our effort, and there's not a lot of transmission happening in the community. If we are seeing more cases in the community, that means we need to put more effort in the community in reducing the community transmission. It is likely that anyone who is a close contact, that they may develop the disease, and that's why the case and contact management is critically important to ensure that they are getting the right advice and they are following the advice. That's the other important piece. All the close contacts need to follow the advice of public health to prevent getting the disease in the first place.
Any questions from AM 800?
Dr. Ahmed, you just mentioned how the number of cases in Windsor-Essex are declining. Are you concerned with some of the restrictions being lifted that could change?
Well, I think we'll have to wait and see. There are not a lot of good promotional messaging what we have done to remind the residents. So far, the residents have done an excellent job in following the public health recommendations, and we anticipate and expect that people will continue to follow those directions. It is critically important more than ever because now there's a likelihood of more people going outside, having more contacts, and it is absolutely important that everyone should be maintaining physical distancing, hand washing, following all the public health recommendations as we talk about every day.
Just a follow-up question. This question was asked to the Premier yesterday by a reporter, but I want to ask you as well. Is it odd, strange? I think people are confused. So a number of stores will be opening, but families cannot see each other or have more than 5 people. So, for example, if I want to go to my mom's house because I don't live with her, I can't. But I can go to a store that has, for example, 70 people in it. Just doesn't seem right or doesn't make sense.
Well, I think we'll have to look at all those recommendations again, and I think sometimes we just have to follow what we are looking in the community. One of the easiest answer that I can give you, it's a different thing. When you are in a closed setting, in a closed environment, the time, the contact time, everything is different. And compared to when you are out in the retail sector, where you are coming in contact with, for a brief moment, with strangers or people, and then you just basically move along, and then you just do your work. But as I said, I think we have to revisit our recommendations in terms of what we are recommending right now. Things have been moving quickly with respect to reopening, and some of these recommendations, how does it translate into the community, and what does it mean for an average household in terms of meeting their family members or their brothers, their sisters, their mom, dad. I think we'll have to revisit all those recommendations as we move forward, and I'm expecting that some of these changes will happen.
Thank you.
Any questions from Windsorite?
Yeah, I'm looking at the long-term care and retirement home outbreaks chart on the Health Unit's website. And in the last 3 days, we've only had one new case listed there, and it was one new staff member from the new outbreak. Yet in the last couple of days, we've had 6 new cases yesterday and 11 new cases today. Are the majority of the new cases no longer taking place in long-term care, and are they community and close contact?
Yes, and one of the graphs that I showed does show that distribution of cases in the community as well as in the long-term care home. And so clearly there are a number of measures that were put in place in the long-term care home roughly around mid of April. And so from that point and to this day, there are a lot of efforts and extra effort was being done at the long-term care home and retirement home to protect those vulnerable population. So that's probably one of the reasons that we are seeing a decline in the number of cases in the long-term care home. But still, just looking at the number of homes that are currently in outbreak, and I think it's a concern, and we like to see these homes coming out of the outbreak at the right time and reduce that number of active outbreak in our community.
Any questions from the Windsor Star?
Yes. Have all of the long-term care and retirement homes completed their testing, even the ones that opted to do it in-house?
I believe so. That's today is the day that everyone should be completing, except for some of the staff, which may still be delayed. But the residents, I believe that everyone is completed.
And do you have the number of migrant workers who have tested positive on you?
I don't have that in front of me, but I think it would be roughly between 25 to 30.
Okay, thank you.
Any questions from CBC?
Dr. Ahmed, with slow reopening happening this weekend, I'm just wondering if there will be bylaw officers or health unit staff out ensuring that businesses and people are respecting restrictions.
Yes, our bylaw, our tobacco enforcement officers and public health inspectors were out and about even last weekend to ensure that the businesses are complying with the regulation and the Emergency Management and Civil Protection Act. There were some opportunities for us to provide education, but majority of the businesses were in compliant with what the Emergency Management and Civil Protection Act allowed. And they will be out there this weekend as well, and we will investigate some of those concerns as well.
Is there, sorry, just to follow up, is there any focus? I mean, there's a lot that's opening up this weekend, right? Is there any focus for those officers?
It's basically not a focus at this point. It's generally it's a complaint-driven investigation that we do. Sometimes we just do a proactive work that visiting some of these facilities, but there is no plans to target any specific business.
Any questions from Blackburn?
Yes. I wanted to ask you, Dr. Ahmed, with these businesses opening and purely from a public health standpoint, if you think that we're ready.
Well, I think there are a number of factors that we need to consider. What we have been noticing in terms of the number of cases, it's been getting stabilized at this time. And the number of new cases are stable. The number of cases in the community is decreasing. We are heading in the right direction. The timing, when to open, I think it would be a difficult one to estimate. And there are other factors that come into play. From what we can see is we are moving in the right direction. The timing can be anytime we can choose.
And as a follow-up, I wanted to ask you, because all of this, of course, depends on a lot of testing. Yesterday, the health ministry said that now that we're done testing in long-term care homes and retirement homes, for the most part, do we have the capacity to start testing people who are only showing maybe one symptom?
I do believe that we do have that capacity, and we've always encouraged people to go for the assessment center for testing. We also have option for people to go to online assessment and then get an assessment done by a physician, and then probably depending on the assessment, there is a recommendation if they need to go to the assessment center for testing, they should go for testing. We have never said that people shouldn't go for testing, especially if they're symptomatic. Asymptomatic people, that's a different question, but anyone who has symptoms, and the list of symptoms are on the website, and if they fall under that recommendation to go for testing, they should go for testing.
Any further questions from CTV?
Just going back to what Rob Hindi was talking about earlier with the opportunity to visit with family members. I'm just wondering, I know there's always planning going, and I know there's a lot of things in the pipe that we don't know about yet. So is that one of the topics that's in discussion, maybe at the provincial level? I don't know if you're involved in any of that, where family members can, or, friends can reconnect?
Definitely, I think those conversations have been happening for some time now. The timing is the issue, that when do we do that? There are other places, other jurisdictions, other countries that have come up with more creative ways to slowly expand the circle of who you interact with. And that can be like a small family bubble that you can say that, 4 or 5 families who are not seeing anyone else, maybe they can start to come and interact with each other, and then expanding it further depending on how the community is. So we think that eventually we will start to ease off on some of those restrictions, but that is still in place, so please be careful. Right now, we're still limited by the number of people that we are seeing right now, but the expectation is, as we are gradually reopening the businesses, there'll definitely be considerations on making some of these flexibilities to allow people to meet their families first and then friends.
Okay, so I guess the next question is, do you see light at the end of the tunnel? Because I know a lot of people are, like cabin fever, right? It's like, oh, I got to get out, right? So do you see light at the end of the tunnel for people?
Well, I guess so, yes, because that's the other thing that everyone who have been following all these measures, there has been some anxiety in some individuals that they want to get out there. And for the right reason, that the weather is nice, and so I would say try to follow the most the least risky things, like going out in the parks or places, maintaining physical distancing where you're not interacting with anyone. Spend some time outdoor, which we have already said that it's important for people to go out. As far as congregating, and especially in large gatherings, that's still a no. And people should be mindful of that.
Any further questions from AM 800?
I have two questions. First question, when it comes to boating, Dr. Ahmed, how many people are allowed on a boat? Is it the same rules, 5 people or less?
I believe so. That's, again, depends on the size of the boat. I don't have the exact detail, but if I have to read it, I would say that, 5 people are at least a family. If it's just one family, maybe they can be at the boat, and also the ability within the boat for physically distancing. And even if you're going other than people who are not part of your family, what is the ability for you to physically distance from each other? So I think those are all the consideration that you have to make. And again, depending on the size of the boat too, we don't know how big or small boat we are talking about.
And follow up, just want clarification here. is it safe to say every retail outlet, if you're not in a mall, is allowed to open this coming Tuesday?
Well, most of them, yes. And again, we are also trying to understand everything that is in the document, but pretty much every stores that have a street entrance, they can operate.
Thank you.
Any further questions from Windsor-Essex?
No thanks.
Windsor Star?
No, thank you.
CBC?
No, thank you.
Blackburn?
I just have one question. You mentioned off the top, Dr. Ahmed, about misinformation on social media. How concerned are you about this? Because we are at a critical point right now as we start to reopen the economy. How big a threat is this?
I absolutely see that as one of the biggest threats, and we have seen that right in the beginning when it all started. There was a lot of misinformation, and sometime in the middle, I think people recognized that this is a problem, and they resorted to the credible information piece. But as the restrictions are easing off, we have seen a surge in the misinformation as well, that what people are interpreting, what does it mean, and how they can protect themselves. So I think that's why it's critical at this stage to avoid any of those misinformation, stick to the credible sources, trust the experts. And that's all I can say. Our health unit website have good, credible information. We are updating it regularly with new information and in an easy to find way. But there are other agencies, credible agencies, that you can go and also visit to get credible information online.
Thank you.
Thank you, everyone.
Mike, thank you. Dr. Ahmed, I just had a question with the one pie chart you put up there about the deceased cases and the resolved cases, and you mentioned that it didn't include the field hospital. My dad's at the field hospital, so I'm just wondering about the field hospital. I'm just curious why the field hospital is not included.
So the reason that the field hospital is not included, because it's when we are putting up this graph, we have a hospital column, and then we have everyone else in the community. So if we have to put all these people who are in the field hospital, I'll probably put them outside of the hospital system, because that's not typically the hospital care that they're getting. So that was a question that, where do we put, whether it would be appropriate or not. It's just a matter of including in which direction or which section that we will put in. So that was the reason that we excluded that, for the ease of understanding and making a distinction that those who are talking about that in the hospital, they're in the hospital, and everyone else, if they are self-isolating in their homes, their long-term care homes or their retirement home, which is their home, so we treated them as they're self-isolating there.
But, are things going well at the field hospital? Are people getting out of there? Are they dying from this, or are they healing from this?
Well, I guess, again, I won't be able to answer that question because I'm not operating the field hospital. And when they're moved there, they have there was a need to take those people from the facility to move in a facility and assess all those risks and benefits. There's always some caveat, whether you leave them at the long-term care home or whether you take them to the field hospital. There's risk involved in both the situation, and those individual decisions are made on the basis of the relative risk of where do you put them.
Thank you, everyone.
Thank you.